How does intravesical chemotherapy treat bladder cancer? Imagine fighting bladder cancer right at its source with a targeted approach that minimizes side effects. Intravesical chemotherapy does just that by delivering powerful drugs directly into the bladder through a thin tube called a catheter. This method allows the medication to come into direct contact with the cancer cells lining the bladder, which are often confined to the inner lining in early stages of the disease. Because the drugs stay mostly within the bladder, they can attack the cancer cells effectively while reducing the risk of widespread side effects that happen with treatments that circulate throughout the entire body. This treatment is mainly used for non-muscle invasive bladder cancer, which means the cancer hasn't grown into the deeper layers of the bladder wall. Usually, patients have already had surgery to remove visible tumors, called transurethral resection of bladder tumor or TURBI. After this surgery, intravesical chemotherapy is often given to eliminate any remaining microscopic cancer cells and to lower the chances of the cancer coming back or becoming more invasive. The drugs used in intravesical chemotherapy include mitomycin C, gemcitabine, doxorubicin, epirubicin, and docetaxel. These medications are instilled into the bladder in a liquid form, allowing high concentrations to act directly on the cancer cells. They work by interfering with the cancer cell's DNA or cellular processes, which leads to cell death. The timing of treatment is important. Usually, chemotherapy is given soon after TURBI to target leftover cells. It can be a single dose or a series of weekly treatments over several weeks, called induction therapy. Sometimes, maintenance doses are given over months to help prevent the cancer from returning. One of the biggest advantages of intravesical chemotherapy is that it stays mostly within the bladder, so patients often experience fewer systemic side effects like fatigue, nausea, or immune suppression that are common with intravenous chemotherapy. To improve how well the drugs penetrate the bladder wall, some techniques like electromotive drug administration use electric currents to help the medication reach deeper tissues, potentially increasing effectiveness. While generally well tolerated, some patients may experience local side effects such as bladder irritation, increased urinary frequency, painful urination, or blood in the urine. Rarely, some absorption of the drug into the bloodstream can cause fatigue or a temporary drop in white blood cell counts. For patients who do not respond to other treatments like Bacillus calmette-guerin immunotherapy, intravesical chemotherapy offers an alternative option. Overall, this treatment takes advantage of the bladder's unique anatomy to deliver targeted therapy directly where it is needed most. It helps kill cancer cells effectively, reduces the chance of recurrence, and preserves bladder function. However, it is essential to work closely with healthcare professionals to develop a personalized plan, monitor for side effects, and ensure the best possible outcome. Always remember, medical treatments should be guided by qualified healthcare providers who can tailor therapy to each individual's needs.